Okay, hello and welcome everyone to tonight's webinar, exploring free and low-cost mental health services in the Canberra region. Before we start, we would like to acknowledge the Ngunnawal people, the traditional custodians of the land we are meeting on. We acknowledge and respect their continuing culture and the contribution they make to the life of this city and this region. We also extend that respect to any First Nations people joining us for tonight's event. I am Dr. Leonie Harcourt, a GP education advisor at the Capital Health Network. And also with me is Kanal Mohiti, the events lead at Capital Health Network, and of course, our wide panel of amazing expert speakers. I'll soon hand over to the speakers, but just to outline how the event will run tonight, please type any questions or comments into the Q&A box on your Zoom screen. If you have a burning question, just say burning question, and we can ask them straight away after the speaker has presented. But we'll also have a Q&A session once all of our speakers have finished. The webinar itself will be uploaded to the Capital Health Network YouTube channel in a couple of weeks, and you're welcome to rewatch it or share it with your networks. Please also feel free to self-report 1.5 hours of educational activities to your CPD home. So now over to our speakers, and our first speaker tonight is Andrew Jin from Meridian. Meridian is a community-controlled, peer-led organisation offering health and social support services to diverse communities in the ACT and surrounding regions. Andrew, him, is a clinical care coordinator at Meridian Wellbeing Services and an accredited mental health social worker. He provides inclusive, person-centred mental health support for LGBTIQA plus communities across the ACT. So over to Andrew. Thank you very much.
Apologize, I was muted. Thank you so much, Dr. Harcourt, for the amazing acknowledgement of the country. I also want to honor the elder HIV and LGBTQIA plus community, sex worker rights activists who have fought against stigma and discrimination. Also, it's worth to say that it's World AIDS Day today. So a bit more about Meridian as an organization. So on top of mental health services, we also provide education, sexual health promotion, aged care finder service, sex worker outreach program. Myself is from the mental health service, so we'll now dive into a bit more in details. We have two main service pathways. One is counseling and another one is psychology. So both services are open for the LGBTQIA plus community and also people who are questioning, who are exploring their identity. For counseling service, it's a bit broader. It's also open for the community family members, carers, and allies. And as well as for people living with HIV and impacted by HIV, these people are prioritized by us in regards of the waiting time. Also for sex workers, the eligibility requirements is that the person needs to leave work or study in ACT. And when it comes to counseling, it's slightly more flexible. So if the person is working, studying remotely at an ACT organization or agency, they should be eligible for our service. Both services are free. There's no service charge. However, for psychology service, we do require a mental health care plan. And it is not used for rebate purpose. It's only for us to obtain the information and to have a better understanding how we can better support the clients. Quite unfortunately, only in the past few weeks, we received a high number of referrals. So currently, both referral pathways have been closed for both services. We are expecting that the referral will be reopened in the new year. When it comes to our service model, we normally deliver 4 to 8 sessions as one therapy. The exact number will be collaboratively determined between the clinician and the clients. And there is a cap for 12 sessions for each 12 months. However, as I mentioned, that this cap and also the waiting time is not applicable for people living and impacted by HIV. We are a multidisciplinary team of psychologists, counselors, and myself, clinical care coordinator, as well as peer navigator. We had a well-being peer worker, but quite unfortunately, at the moment, that specific peer support is not available, and the peer navigation is only applicable for people living and impacted by HIV at the moment. There are some common topics that we often help clients to explore. For example, general mental health challenges such as anxiety, depression, talking about coping strategy and psychoeducation. And of course, because we work very closely with the LGBTQIA plus community, so exploring identity, sex, and sexuality, also non-conventional family and relationship dynamic, um, as well as how to come out to family, closed people in close relationship, also colleagues and classmates, and other topics including minority distress, intersectionality, discrimination, internalized oppression, and of course loneliness and isolation, which is quite a common thing that our community come across with. And commonly that would be coordinated with me and the peer worker too. So when it comes to the scope of practice, there are certain area that is out of our scope of practice, including couple counseling. So we are quite open to help clients to explore their relationship. However, it won't be in a group setting. The therapy will mainly focus on an individual level. Currently, we can't provide diagnostic assessments. That also includes diagnosis of gender dysphoria for adolescents. And currently, this is still required by the latest standard of care. However, there might be some changes coming up. Other field of practice that are currently out of our scope of practice, including some specialized treatments, for example, DBT, dialectical behavior therapy, and EMDR. This two links to the referral forms. As I mentioned, quite unfortunately, they're both closed at the moment. And worth to mention that both services are open for clients self-refer and also for referral from by other professionals. That also applies to the psychology service, but which of course, quite a lot of the time that the client might need to see a GP for the mental health care plan first, so it makes sense if the referral comes from the GP. On top of the two main services, we also provide some resources. This link of the LGBTQIA plus inclusive mental health professionals is a list of inclusive mental health professionals based in ACT and also in other states and territories who can provide remote mental health supports. And it is a list of psychologists, psychiatrists, counselors, psychotherapists, mental health social worker, and other therapists. So all of these professionals are private practice, and it's mainly serving for the purpose of helping clients to explore other service options. When it comes to us, when we have too long of a waiting time, or we can't provide the support the client is looking for. These resources can be found on our website, as well as those two referral links. And if you're particularly interested in our service, feel free to let me know. I will also leave you some time for any urgent questions. Otherwise, we might also leave some time at the very end of this webinar.
That's great. Thank you, Andrew. There's no burning questions at the moment, but yeah, they may evolve throughout the night. So yeah, there's that opportunity at the end of the speakers to have a Q&A session there as well. So now we'll move on to our second speaker. So Billy Ann Bambrick from Headspace. Billy Ann Bambrick is the service manager of Headspace Tuggeranong. She's been part of the Headspace and Grand Pacific Health team for 4 years. Billy Ann will talk about the Headspace, the services that Headspace provide in the ACT at Tuggeranong and Headspace Canberra. So thank you very much, Billy Ann, and over to you.
Thank you very much. So yes, on behalf of Lachlan, so he's the manager of Headspace Canberra, and I'm at Headspace Tuggeranong. So I would like to actually, on behalf of Headspace, so acknowledge the Ngunnawal and Ngambri peoples, the first peoples and traditional custodians of the land we're on. And it really is the world of Headspace that it's about ensuring that we're providing service that is welcoming, safe, and culturally and appropriately inclusive. So Headspace is probably one of our worlds that it is for youth, and for youth mental health is probably what we're best known for. And one of the things about us is we still are that world of a free service for young people. We are limited, unfortunately, from the ages of 12 to 25, which is one of those challenges for some of our young people who are not quite 12, or those who are about to turn 27. Because in that 25th year, we will try and hold them until that 26, and that's when it's actually a time then we need to move outside our service. Probably what we're best known for is mental health supports. In a past world of Headspace, we often used to use the language of mild to moderate. We've probably moved a little bit away from that language about mild to moderate mental health challenges, because we are looking at young people coming through with the level of complexity. So sometimes mild to moderate is not the best description anymore. So when it comes to mental health, we really are we're attempting to be a place that a young person will have their first conversation within at least 14 days. And we often do that on the phone or face-to-face, but ongoing support still is taking that good 30 days before there might be more than just an initial assessment. So I've put up on the screen, though, the other services that we do have at Headspace. So we do have a work and study program at Headspace Tuggeranong. So that is actually an in-person program that works with young people looking for employment or re-engagement in education. And it normally is about that world of a holistic care. So the clinician, the work and study vocational specialist, and the young person working together about accessing those things in the community that they really need to be part of. Our AOD support is kindly supported by Directions. So we have some really great counsellors who work with us on site who actually provide support for our young people who are seeking to work with their AOD challenges. And also we do have some physical and sexual health support. So Headspace Canberra does have a GP that works with them for 2 days a week. Headspace Tuggeranong at this point in time, we do not have a GP that's currently with us. We're currently advertising in case anyone is looking. Our referral pathways. So probably the main way to actually access our service is young people can do a self-referral, family do a referral. So it's really just a simple phone call or walk-in or a written referral that they can complete. From a GP, from the primary care world, a written referral and a GP mental health treatment plan is really helpful because it provides us information about the young person before they come in the door, but also enables that written pathway between us and yourselves. So when a referral is received, we would normally let the GP know we've got it, and then also let you know the outcome of the first assessment in case we are actually making the decision we're not the best place right now and we're actually referring to another location. So once it's received, that's where we'll contact the young person to actually have a phone call or a face-to-face, the initial assessment. Probably one of the things that it does become a little bit stressful for young people is when they're referred to us, but we may not be the best service for them. And I'm talking more about when it comes to some acute presentations and that crisis world, that we're really not sitting in a space we can provide that immediate support. So that's where sometimes it is in the young person's best interest. If it needs to be CAMS or adult mental health for post 18, sometimes it is a world, how do we engage them, and that services before us. So after referral is made, and I've already sort of mentioned about our assessment session, we'll often call it intake. We do have a team that will come together and have a conversation about what the young person has told us, what their needs are, and the kinds of supports they're looking for. Because a big part of what we really push is trying to support the young person with their own journey about their mental health and what sort of services would best meet them at the moment. Some of the things we offer, and we'll talk with young people about, is whether it's a group program, or we may be talking more in the world of some brief intervention, and that's probably where we can often see a young person quickly within that 30 days, if it's a one-off or a couple of sessions to address something that's a little bit, I'm going to say, in the moment, a bit more psychosocial orientated. We can actually address that in a shorter term care. With a mental health treatment plan, we also sit in the world of, we'll offer care under that world. I'm fairly lucky at Tuggeranong. I have a clinic psych who's a private practitioner, so we will build against the mental health treatment plan. And we also have a couple of clinicians who are registered psychs, mental health social workers. So we will work to the mental health treatment plan and maintain that communication with the GP as well. So other services would be our AOD counselling, but also the work and study, whether it's in centre or online. And we also use Headspace for ongoing support for young people and parents. And we also access MOST as a digital mental health support. And I suppose the thing is, we'll often use the term as no wrong door, but we all know sometimes all of our services may not be the right door right now. So we really work with the young person and family about a supportive transition to the next place. So how do we actually support you to engage with CAMS or another location, or the early psychosis team? So with Headspace Early Psychosis, they work out of Headspace Canberra's building and work with the primary care team there, but they'll also come to Headspace Tuggeranong to see young people. So part of our world is trying to limit the amount of travel young people might need to do. So if Tuggeranong's a better site, Headspace Psychosis will come to us. If Canberra's a better site, they will be seen on the other side of town. So I've just really done it in very big print about where we all are. So Tuggeranong, and those who know down in Tuggeranong on Soward Way, and if you know the service station, you'll find us pretty quickly. And Canberra has just moved, and I shouldn't say just, it's a couple of months, but Headspace Canberra is now on Northbourne Avenue, so in Lynham, and it's on the tram line. I'm going to say sometimes parking's not the easiest around them, but the tram line stops right out the front. And that's probably it from Headspace.
That's great. Thank you very much, Billy Ann. Okay, on to our third speaker for the night. So our third speaker is Amelia Jenchik from the Psychology Clinic at the University of Canberra. So Amelia is the manager of the Psychology Clinic at UC and brings nearly 10 years of experience as a psychologist in diverse settings, working with children and adults in therapeutic practice and also with cognitive assessments. She's recently returned to Canberra and is passionate about supporting Master of Psychology students as they begin client work and helping them build skills, confidence, and reflective practice. Thank you very much, and over to you, Amelia.
Thank you, Leonie. I'll just see if I can get my slides up. So I've just sent a request to share my screen.
Yeah, they haven't come back yet. So I can also share your slides if we can't get them up.
Yeah.
Yeah. Okay, maybe I can share them.
No, I've just allowed Emilia just for the co-host.
Oh, sorry.
You can try again, Emilia.
Okay.
Thank you. That looks like that's doing what it should do. Okay. All right, I'll go back to the start. All right, hopefully everyone can see those.
Yeah,
great.
That's good.
So thank you for the lovely introduction. I'm going to present about the UC Psychology Clinic. So these are our best contact details. So hopefully, if you are interested in more information about the services that we provide, you can come back to these slides, and that phone number goes to our UC Health Clinic reception, and that email goes to them as well, so they can then pass on the message either to me or, to whoever the relevant person is on the day. Okay, so who are we? So the UC Psychology Clinic it's a student-led clinic. We're located on the UC campus in Bruce. So what that means, I suppose the student-led service, it means that it is staffed by provisional psychologists. And I'll go into a little bit more detail on that on the next slide. But it is provisional psychologists and UC students who are under the supervision of experienced clinical psychologists on site at the clinic. So what we aim to do is to provide a low cost service. It's not completely free, but our aim is for it to be lower cost than if individuals were to go privately. Still using evidence-based psychological care, and it is open to the wider Canberra community and public. So who we see is basically children, adolescents, and adults up from 7 years of age. So 7 years for individual for a therapy service is the youngest age that we see. And we generally offer, psychological care for common concerns like anxiety, mood disorders, stress, grief, life transitions, self-esteem issues. A lot for, especially for our younger clients, we see a lot around emotion regulation, sleep issues across the board as well. We do, I suppose, because it's a student-led clinic and it is provisional psychologists who are a little bit newer in their experience and training, in this field, we do have some screening and some exclusion criteria. So we, unfortunately, what's above our scope is trauma-related concerns where trauma is the primary focus. That really needs a little bit more specialized care and therapies that our students aren't yet trained in. Eating disorders fall under the same umbrella, and any significant, harm or suicide risk. So more of those kind of urgent, presentations also fall outside of, what we can hold and sort of work well with, as well as more complex mental health presentations. I will say, I think I do cover this on the slide after this, but we do, in terms of our referral process, we complete screening. So, really the best way, I think, if you have an individual that you're wanting to refer, or, if you're wanting to sort of refer yourself, is to call through to reception. We have a screening process, so our students call and we have quite extensive questions that they go through to really get an idea of what's going on for an individual, what someone is seeking help with, and on that call they can provide a lot more detail about the service as well, and some of the specifics that come along with it being a student-led clinic. So that's often, I'd say that's the best way to get a little bit more detail and information, if you're unsure if it's the right service for you. So we do provide a few different, programs and services. The big one is individual therapy. And again, we very generally class this as being for mild to moderate mental health concerns. We do have some session limits. There's a little bit of flexibility with those, but generally we do around 12 to 14 sessions. Our primary approach is cognitive behavioral therapy. So we do try to get people in for therapy to come weekly, just to try and sort of work to, what we see as resulting in the best outcomes for individuals that are coming to the clinic. We do also offer group programs. We offer almost the whole suite of Cool Kids, and we do try to run those programs a few times a year. and it all sort of depends on interest with what we can get up and running and timing. But we regularly run Cool Kids, Cool Little Kids, Chilled, which is the teen version, and we often run a couple of additional groups and workshops. So most recently, we've been running for adults, so a stress management workshop and one for procrastination as well, which is generally popular with university students, but yeah, probably, across the board, useful. We do also offer cognitive assessments, and we have a referral list for and a screening process for. Our waitlist for these is currently closed, but we expect that it will reopen at some point, maybe early to mid next year. We do offer generally ADHD assessments for children and adults, intelligence testing, and educational assessments for, if there are learning difficulties or if there is queries around maybe specific learning disorders. And as I mentioned, all of the services are delivered by University of Canberra students who are either completing a Master of Clinical Psychology or a PhD, combined Masters and PhD. So those are the clinicians that you would see, and they are provisionally registered, and they are under very close supervision by approved supervisors who are experienced clinical psychologists. Okay, appointments and wait times. So our initial appointments tend to be 80 minutes. This is for individual therapy. We do a bit of a longer initial appointment, and then ongoing sessions we book weekly, and they go for about 50 minutes. Our wait list, so we do accept referrals year round. We do have a Christmas close down period. So, this is sort of our wind down point, and, we'll be back up sort of in operation around February next year. Occasionally we close wait lists. So the main one that tends to close is cognitive assessments and sometimes Cool Kids. Individual therapy we tend to try and keep open all year round. We don't offer walk-in services. I guess we have a referral process, so you can absolutely self-refer, and for that you can email the reception team or just call our main reception number, and you get put on a referral list, and then our students will call and do the screening process, and we try to be relatively efficient with that. We do also accept referrals from GPs or school psychologists or other allied health professionals. And so we follow the same process. We would call the individual being referred to complete the screening. But, a GP or another professional can definitely kickstart that process. These are the details again for any questions, or if you want to refer anyone to the referral list for screening. Just to note, there is no mental health treatment plan required, so you don't need a GP referral. So that's, hopefully makes it a little bit more accessible. A little bit of additional information just about costs, because I feel like that's usually, that's a kind of key part of how accessible a service is. Unfortunately, we're not a free service. These are our costs, our current costs. But again, this information can be provided by reception, or by email at any time. We do have parking on site, that's free. And there's different costs for the assessments depending on what, how big the assessment is. And the same for group programs, depending on which Cool Kids program it is or how many weeks, a group program is running for. But generally, if you're looking at individual therapy, an initial cost is $70 and a review is $50. And that's it from me. I'm happy to take any questions.
Thanks, Amelia. There is a couple of questions. So I think there was one about costs, and so that's kind of covered. But I just was wondering, is there any discount for concession cards or pensioners or?
We do have some concessions for university students. It's definitely worth, I guess, contacting reception and asking about if the concession extends to, yeah, like healthcare card holders or pensioners. Yeah.
Yep. And the other question is, do they see the same practitioner for all the sessions if they're doing the individual therapy?
Yes, yeah. So our students are on a essentially it's almost a year-long placement. So that means you're seeing the same practitioner. So you get that continuity. We do have times for example, now if somebody's, hasn't quite gotten through all of their sessions, and a student is finishing up their placement at the end of the year, then we look to hand over, to another student. So that's really the main time you may have a change, but otherwise, yeah, same practitioner the whole way through.
That's great. Thank you. Thank you so much, Amelia. So now we'll move on to our fourth speaker, who is Jeanette Bruce from ThinkWise. So Jeanette is a senior clinician of the ThinkWise service, and she's a registered counsellor with clinical expertise committed to providing ethical and professional care. Jeanette uses evidence-based therapeutic models to assist aged care residents in managing psychological distress and work towards sustainable therapeutic outcomes. So ThinkWise is a service for patients or people in residential aged care homes. So thank you very much, Jeanette, and over to you.
Thank you so much, Leonie, and hello, everybody. So just want to talk a little bit about the ThinkWise service, which is a relatively new service here in the ACT. Just trying to, yes. But before I do, just want to also, as others have done, acknowledge the traditional custodians of the land that we live and work, and pay my respect to elders past, present and emerging, as well as just also recognise and respect and affirm the individual invaluable role that people with lived experience have in working with those people and contributing to our sector. So I will just move a little screen. So just to provide an overview of what the service is. So we are a program that's part of Think Mental Health, which will be spoken a little bit more about later in this education session. But we are basically a free psychological support service for individuals who are living in residential aged care. And the WISE in our service stands for Wellbeing, Independence, Support and Empathy. So to be eligible, individuals must be residents of aged care homes and facilities in the ACT. And that's pretty much the main criteria. So not family and friends, but we can kind of support people and provide other referrals to people in that regard. But if you are a resident in an aged care home, we can provide this service to people. So we do in-reach support, which means we sort of do travel across the ACT to the different aged care homes that we're currently working with, and we use an evidence-based model of care approach. So the service offers 6 to 12 sessions to people, and we can extend that somewhat if required, but that's kind of the framework in which we work. And in addition to actually supporting individuals, we also work with staff, and we aim to build the capacity of staff in helping them to better understand mental health and to better be able to support the mental health needs of the residents in those homes. So we provide education to staff in that regard as well. So we focus on the residents' emotional well-being, as well as I said, the mental health education of the staff. The process is obviously, it's also confidential, and the idea is to not become another thing that the staff need to do, but to also kind of just work in with the process and the systems that the aged care homes have in place. So we do that by liaising with GPs and other health professionals involved in the residents' care. And yeah, we basically aim to achieve better mental health through initial assessments, referral or intervention, review and discharge, and basically helping to ensure people's well-being, independence, support, and empathy. So we currently we're operating in 11 organisations. There's about 5 more coming on board in the next week or so, which is exciting. And basically, we have an MOU with those organisations, and we can go in there and promote ourselves and let the residents know, attend residents' meetings, as well as staff meetings, and just let people know that this sort of new free confidential support service is available. We support people with mild to moderate mental health needs, as well as those struggling with adjusting to living in an aged care home and struggling maybe with transitioning to living in an aged care home. We do support people also with dementia. However, our key criteria is that individuals just need to be able to basically benefit from talk therapy. But we are a flexible program, and we're trying not to be too black and white about anyone who's referred to our service. So the intended outcomes of the support we provide is to obviously increase access to therapy for aged care residents, also reduce psychological distress among residents, as I said, improve capability of staff to provide that support as well, and also to strengthen collaboration between aged care and services like ours. The waiting time is relatively short, particularly because we're a relatively new service and new aged care homes are coming on board, as I said. So we, at the moment, able to see people within 2 weeks and often sooner. So the model is that we go to particular places on a particular day of the week, and then we work with the aged care home to and individuals themselves to work around what's already going on there. Referrals, again, pretty straightforward. We can just be contacted on this email here. Also, the referral forms are on our website. Also, feel free to just reach out and call us. We, again, are trying to just be flexible and open, and if people need to make a referral over the phone, we can work and talk to people from there as well. So they can be made from GPs, they can be made from aged care staff, family members, and also individuals themselves can self-refer. So that is wonderful. And I guess just to wrap up, just to flag that compared to older people who live in the broader community, those who live in aged care are often disproportionately affected by some mental health conditions, such as loneliness, depression, and anxiety. When we work with people, also just to make sure, I guess, we are doing an okay job, we seek feedback and on our service so that we can make sure the quality of the service we provide is high. And here's just an example of some feedback we've had already. Somebody saying that they thoroughly enjoyed their session and found it easy to engage with this person and valued their opinions and ability to make sense for someone to see things from another perspective. Also, feedback from staff at the RACs is listed here. Sort of other feedback, just noting that our service is not only clinical effective, but also deeply humanistic, offering residents a sense of agency, connection, and hope. So that is all from me. But yes, look forward to hearing from people if they have referrals. And it's great to personally have a service like this off the ground. I'm really excited to be part of it. So thank you.
That's great, Jeanette. Thank you. I'm sure you'll get some referrals now, and it's really good to know that that kind of service exists for people in residential aged care homes, because I guess they kind of tend to be neglected with attending appointments outside of the homes and things like that. So it's great that you go and visit them as well. Okay, now on to our fifth speaker. So our fifth speaker is Dr. Juin Chu from the Junction. Dr. Juin Chu is a long-standing Canberra GP who now works as a mental health GP and provider of focused psychological strategies in primary care, both in her private practice and at the Junction. So thank you very much, Juin, and over to you. Juin, you're on mute.
Can you hear me now? Beautiful.
Good.
So thanks everyone. It's lovely to be here with you all tonight. So yeah, I work at the Junction, and the Junction is a free youth health service for young people aged 12 to 25, and particularly for young people that might be facing disadvantage and barriers to accessing mainstream services. And it's run by Anglicare, and it's in the city. So we're a primary healthcare service, and we offer regular general practice care, mental health care, nursing services, and we have youth workers and an outreach mobile van as well. And as I said, we're particularly seeing young people who have had often a history of abuse or homelessness, been involved in out-of-home care, who might be disengaged from school, struggling with substance use, and may be sort of separated from their families. So particularly young people who might face barriers, being able to afford or access other services. And our whole service is, I guess, part of our mental health care team. So there's a high kind of burden of struggles and mental health care in our clientele that we're seeing. So we're all kind of attuned to that. But I guess in particular, so I'm working there as a mental health GP. So I provide counselling, which is focused psychological strategies. So it's sort of broadly based on CBT, but sort of tailored for the particular young person, and general supportive counselling and mental health care. At times we've had a rotating psychiatrist from CAMS as well, but that's not a reliable thing. We don't have them at the moment, but sometimes we do have that as well. We also have a great team of youth workers, and they provide a lot of support. Particularly, they can offer case management to young people, help people with goal setting, assist them with education, employment, help them find housing, navigate Centrelink, help with things like quitting smoking. And we also have a sort of emergency relief fund, so food pantry and some essential services and laundry and things. So lots of kind of doors of entry for people, depending on what they might be needing. And the youth workers also offer some groups for young people. So we've got a weekly art group, we have a monthly young parents group, and the youth workers also do outreach to a lot of the high schools, so where they'll do education on STIs, consent, self-care and things like that for young people, often that the schools have identified as maybe benefiting from that kind of support. And I've got a little picture of our van as well, which, as well as our sort of primary location that I'll let you know about in a moment, we've got an outreach van, and that goes on most Wednesdays, either north or south side. It has our regular GP and nurse, and that's to sort of particularly be a drop-in service for people that might not make it into us in the city. And they can make appointments, or they can just come along if they see the van there. And where are we? So we're in the city, and probably the easiest way is to think that we're next to the skate park, but it's on Kooyong Street at the corner of Kooyong and Scott's Crossing, and we're on level 2 there, and we're open weekdays, and we're sort of by appointment, as in, so ring this number here to make an appointment, but there's always a youth worker on duty as well. So sometimes people will come in, or a friend might bring them in, or a caseworker might bring them in. So there's always someone to at least introduce them and triage what they might need. And in terms of our wait times, at the moment, for our regular GP, it might be 1 to 2 weeks to see him. And for me, because I'm only there sort of 1 day a week, it's probably about a month. And we sort of have a fluctuating, people will sort of come in and out depending on what they're needing. So, and we've got an email there, and as I said, we've got our mobile van for outreach. And yeah, we're just really there to provide whatever young people are needing, sort of as a whole team. So, and we also have regular kind of case conferencing meetings where we'll talk about people that we're all seeing and how we can support them as a service. So yeah, so thanks for letting me talk about the Junction, and happy to take any questions at the end or now.
That's great. Thanks very much, Juin. I think there's no questions at the moment, so we'll move on to our sixth speaker. So our sixth speaker is Joseph Sabadash from Directions Health. Joseph is an alcohol and other drugs practitioner counsellor at Directions Health, specialising in one-on-one counselling, facilitated group works, including working with families and friends of those presenting with substance use issues. So over to you, Joseph. Thank you very much. Joseph, you're on mute.
Can you hear me now?
Yes, we can. Thanks.
Hello?
Yep.
Can you hear me now?
We can hear you. Can you hear us?
Oh, yes. So
Yeah.
sorry. I don't know what happened there.
That's all right. Thanks.
Okay. I'll see if I can get my slides to work because they don't seem to be going up and down either. Let's see.
So I think if you press the arrow button on your keyboard, the left and right arrow button.
There we go.
That's it.
Sorry about that. Directions would just like to acknowledge the traditional custodians from where I'm sitting today, as well as individuals with lived experience. We value their diversity that they bring to this sector that we work in. Directions is an organization that's AOD-centric. We certainly acknowledge people are coming in from different stages in their recovery, and we try to meet people where they're at, but not only for themselves, but for their families as well. We have a therapeutic and self and person-centric and holistic approach. We're primarily based in Canberra, but as you can see on the map, we're certainly branching out into other areas of New South Wales, mostly in the mental health areas. So there are four main sort of categories that Directions works in. Assessment for individuals coming to the programs, seeking education and brief intervention, as well as ongoing counseling. Also case management and crisis support. That's for the individual, but also families and friends who might be affected by the individuals. At the Canberra office, we offer the groups for those individuals, not just one-on-one work. I'm just going to try to move this button. We also have a harm-in approach, which we have a CAN test, which is in the city, and that's for individuals to come and they can have their drugs tested. That's free of charge, and there's no mandated reporting. So if somebody comes in and they want to have something tested to see what's actually in there, the substance, they provide a very small amount. There's the test done, and then that individual is provided with information about what it actually is they might be using. And they're not required to leave any drug or substance they bring in. They actually get to take it with them. We often offer them precaution if it's something that they didn't think they were having, but it is fully confidential service. There's also the Althea program that run out of the Canberra office, as well as the PAP bus and the T25 bus, and I'll go a little bit more into that in a moment. But it offers GPs, staffed with nurses, and we also have a non-dispensing pharmacist on site who offers an NRT program as well as ORT program. We have dedicated psychiatrists at our office in Directions, and we also have one who works off-site. The clinics here offer full health assessment and treatment for any varying health matters. It doesn't have to be an AOD-centric related issue. I'll just go on. So with the TSS program, which is at the Woden office, it's primarily one-on-one counseling support, but as well as case management. And the case management is run by a different program called Alongside. I'll go into that in just a moment. The groups we offer are SMART program, which is basically a peer-led group for individuals who are seeking support to talk about their experience of recovery. And that doesn't have to be just AOD. That can be any type of addiction issue that a person might have, including eating disorders. We also run a mindfulness group, which meets weekly. That's usually read by a staff member, and that can range from a meditative group to mindfulness activities and some breath work. We now run a weekly art therapy program, which is every Thursday from 3 to 5. That actually kicked off earlier this year with great success, so that'll be continuing to 2026. Fortnightly, there's the Compass group, which is the group that is for family members or friends who might be affected by AOD. It's run very similar to a SMART program, if anyone's familiar with that, when that's just a sort of a check-in and a discussion of what they might want to talk about. And it really is about supporting each other, other family members, other friends who are going through a similar experience. The Alongside program is the more of the case management side, which I mentioned before. So currently it's targeted for individuals who are age 16 and older. There are two different sort of pathways to enter that program. That can be through a referral from other programs, or it can be internal referrals, or individuals can self-referral, although that's not quite as common. Sorry, my lights just auto turned off if I went dark. The program is either 6 weeks or 20 weeks long, and it can be modified if an individual requires longer treatment if 6 weeks isn't quite enough. The nice thing about the Alongside, it can help individuals with just, if they need shopping or if they need help getting to their GPs, just basic living skills. Often there are individuals who need just help getting their home cleaned. So it's really a real practical aside to the kind of services we offer. We do know that often the individuals who are are part of the Alongside group do have one-on-one counseling as well. Sometimes even being a patient of the Althea team, which are the GPs and the nurses. The Althea Wellness Center also not only having their suite of offices in Woden at Directions Health, there's the PAT bus. So the PAT bus goes out to different locations. There's Oaks Estate, there's Vets Park, as well as two other locations. Sorry, but that's on our website. I might refer you to that. But the PAT bus goes out. They do have an ongoing clientele base that come to the bus. So if it's not really a walk-in service as such, it's really about just taking the doctors out to community. They certainly will see people if they do have time to assess and see what needs they might have to refer them on to other services if necessary. They do offer ORT on the bus. They can write scripts from the bus as well. So that's been going on for quite some time. The psychiatrist that sits in the office here at Woden, it is through referral, and that usually comes through the GP. It's called a 291 referral. So if you are having one of your clients seeking to have a referral sent through to us, it does need to come through as a 291. There is some assessment that gets done through the psychiatrists have for ADHD assessment. Mostly, though, what we're seeing is that clients who are seeking to have a meds review, and so it's not ongoing sessions with the psychiatrist, but more of reviews and assessment with some follow-through appointments to make sure that the meds review is appropriate for the client. The T25 clinic is similar to the PAT, except that it is tiered towards individuals who are 12 to 25. They have a day at Belconnen, a day in Lanyon, and a day in Woden. They offer a space for young people to come for confidential treatment if they might otherwise not be comfortable. So it's staffed with peer support as well. So that's sort of a new service that kicked off earlier this year as well. Directions also has the Arcadia House, which is a residential program. It offers a 3-month live-in program. It is through a referral and assessment process for an individual to enter the house. It is usually a bit of a wait period. There are 14 beds, 7 female, 7 male. There's 1 detox bed if it's available. If it's not being used, they might give that bed to an individual waiting to seek the 3-month treatment. It is based on a therapeutic community model, so it's quite rigid. Not everybody completes the 3-month, but upon completion of the program, or even if somebody leaves early, they can enter the day program, which is very similar to the residential program, except that they don't spend the night. They just spend the day with the residents and the community. And that includes going to the Smart Recovery group that the residential program goes to, as well as art therapy and mindfulness. And that is staffed by case management, as well as they have access to the GP and nurses here at Directions if they're in that program. The CAN test, which is what I spoke to just a little bit before, is the drug checking service. So that's one of the only, or I think it might be the only permanent sided drug testing facility in the country at the moment. And like I said before, it is completely confidential. And what we're seeing is on the Friday nights, the 6 to 9 p.m., we're seeing quite a large number of young people coming through before going out for the night. There's a big uptake during times of, all of my lights are going off, sorry. There's a big uptake during festival times and things like that. And we do see that people are leaving drugs often that they, were surprised at what was actually in them. So yes, that will continue on. We're hoping to get extra funding to actually extend hours and days. The needle syringe program, there is the permanent office in Woden, as well as dispensing in the city, as well as in Belconnen. The needle syringe program offers clean needles, as well as pill filters for individuals who do use intravenous drug uptake. They also offer some counseling in Woden, as well as free meals and a place for individuals just to come for a non-judgmental sort of conversation regarding what they might be going through. So that they usually come in small packs for people to take with them, so they don't have to actually go to the dispensary and put in the coins. So if you go straight to the Woden office, they are free. And what we're seeing is a real increase in the individuals who will be continuing to come through the program, building those relationships. And that site is actually stocked with naloxone as well, which unfortunately the individuals who run that program have had to use in the past. So there's a lot of trust with that community, which we're happy to see. Yeah, so that's about it. I just wanted to quickly say that as far as referral pathway goes, all the programs are self-referral, with the exception of accessing the psychiatrist, that is referral through GP. Yeah, thank you.
Thank you very much, Joseph. So just a quick question. So in terms of accessing the psychiatrist, do you filter the referrals to make sure that they're your target kind of patients, or how do you make sure that you're not overwhelmed by general referrals for a 291?
Yeah, so the referrals do go through the psychiatrist reception, and they are filtered through to make sure that they are clients that sort of meet the AOD or the assessment for ADHD related to ongoing AOD issues as well. So the whole comorbidity, how exactly they, whittle that down, I'm not really sure. I will say that there's probably a 3-month wait at the moment to even see the psychiatrist for an assessment. So there is a bit of a wait there, but it should be getting shorter, as well as the books are actually closed for the GP and nurse clinic, but we're hoping that there might be a change in early 2026 if we can get another GP to come on board.
Great. Thank you so much, Joseph. So now on to our seventh speakers. So we have Julie Hansen and Lisa Basalis from Medicare Mental Health Centres. Julie Hansen is the Centre Manager for Canberra Medicare Mental Health Centre and was previously the team lead for intake services. She's a mental health nurse with a number of years' experience in acute mental health services. And Lisa Vasalis is the centre manager for the Tuggeranong Centre. She is a social worker with a counselling qualification and has worked across the community and government services for the last 15 years. So over to Julie and Lisa. Thank you very much.
Thank you very much, Dr. Leonie Harcourt. Lisa and myself will be talking about the Medicare mental health services in our region on behalf of our directors, Jason McRae and Vanessa Hamilton. And also thank you to Jeanette, who has read our acknowledgement of country. Think Mental Health has the contract to deliver services at the Medicare Mental Health Centre in Canberra, Tuggeranong, and via the phone line, the ACD phone line. And I think Mental Health also delivers the services for ThinkWise that Jeanette spoke about previously. Currently, there are about 50 or so Medicare mental health centres around the country. The federal government has plans to expand this to over 90. There are Medicare mental health phone lines in all states and territories, which is extremely useful in rural and remote areas, difficulties walking into centres. Locally, there is another centre in Moruya, and persons living in Goulburn and Yass, and all other surrounding areas have access via the phone line or can walk into one of our centres. So essentially, we support anyone who lives, works or plays in the ACT and surrounding areas. Both the Medicare Mental Health Centre in Canberra and Tuggeranong, along with the phone lines, are all fully funded by the federal government via the ACT Primary Health Network, which is also known as the Capital Health Network. Also, until recently, we were known as the Head to Health, but we were rebranded by the federal government. Lisa, if you want to go to the next slide. So what do we do? Both Canberra Medicare Mental Health Centre and the Tuggeranong Centre provide assessment, referrals and a treatment service. The phone line provides assessments and referrals only. All of our services are free. We are fully funded, and despite our name, no Medicare card is required. We find we support a lot of international students who don't have access to Medicare. Whilst no referral is required, we're always happy to receive collateral information. It's extremely helpful, especially for our clinical services such as psychology and psychiatry. Primarily, our intake uses the intake assessment and referral decision tool. That's a framework and a tool that was developed by the Australian government to help clinicians, particularly in primary health care, to determine the most appropriate level of mental health care for a person. It helps guide our clinicians through the initial assessment. There's 8 different domains. Each level of care is scored, and it works on the principle of providing the least intensive intervention that is likely to be effective. So as a service, we put considerable time and effort into keeping up to date with local services in the ACT and our surrounding area, which includes all wait times and accessibility criteria. We support our staff in the centres and the phone lines to work with a trauma-informed care approach. So eligibility for our internal services are based on the needs assessment, or that IAR, and take into account the consumer's capacity to access treatment or interventions at any other service or private options. So while we do try not to double up on services so that we can create access to those that need it the most. At both our centres, treatment and intervention services include individual therapy, counselling sessions, and with a psychologist, or we also have accredited mental health social workers and an occupational therapist, and we have counsellors as well. We do have psychiatry and case coordination, and we have an extensive group program. At the Canberra Centre, we also run a comprehensive DBT program, and a skills-only group. And as I said, all those services are free. Lisa, over to the slide 3. Maybe we're there.
Yeah, number
Yep.
4.
Lovely. Oh no, just still on 3. So our groups are primarily psychoeducation. They're not therapy groups, and they are accessible to everyone, even those that are referred externally to other services. Our groups include a healthy coping workshop, understanding and healing from trauma. We have a men's resilience group, an insomnia group, an introduction to CBT. We also run a strength and diversity, which is primarily for a cold group. We have wellbeing services, which includes our peer-led social group and peer-led mindfulness groups. Right, now we can move on to 4. So we are primarily for those over the age of 18. We do have no age limit. So we have people who, sort of 75 that access the services. We would normally link those under 18 with appropriate services. We don't turn them away. So we do try and just link them in with a more appropriate service, particularly if they walk in the door as well. Despite, as I said, as the name says, no Medicare card is required. You don't need a mental health care plan to access our service. We do see people in crisis. We aren't actually a crisis service. However, we certainly do support people over the phone who are experiencing a crisis, and anyone requiring immediate support or is at risk, we would tend to link them with acute services, but they may also continue to access some of our services during the follow-up time as well. We do provide feedback and copies of assessments back to people that do referrals to us, particularly GPs, always if the consumer wishes us to do that. And our psychiatrists in particular and our clinical services are always willing to work with a person's GP, and by providing regular updates and completion of episodes of care letters. What we don't do, unfortunately, is ADHD or autism spectrum disorder assessments. However, we will work with people that do have those diagnoses. We just don't do them as a standalone assessment. And over to you, Lisa.
In terms of our waiting times for your initial assessment, consumers can just walk in without an appointment, either in our city centre or in our Tuggeranong centre. We do have to physically see everyone that comes through our doors. So at the very least, a staff member will check on someone's safety if we're not able to do the assessment then and there and booking for another time. But we do need to see everyone who walks through our doors. So that is, I guess, dependent on worker availability on the day. If our consumers are then referred to clinical services or care coordination, psychiatry, or support with our wellbeing workers, we're looking at generally less than 2 weeks to get them in with one of those workers, which we're quite proud of. We think that's pretty amazing. Our group programs all run along the school term. So generally, week 1, we kick off all of our psychoeducation groups and our wellbeing groups. And they'll often go for the term and then have that 2-week break. I know that both of our centres work really hard as well to have some kind of group offering over the Christmas shutdown period, although we don't have a shutdown. It's good for everyone to know that we will be closed for public holidays, but otherwise we're operating business as usual. Here are our 3, phone service. There is our phone line. That's a national phone line that people can call to either do their initial assessment over the phone and then be linked either internally with a service either at the city centre or Tuggeranong, or referred on to other services in Canberra because it's used as a bit of a intake referral point. And then As you can see, our city centre has some extended operating hours on a Tuesday and a Thursday. They're open until 7 o'clock to cater for people who might be working and need a later appointment for their initial assessment. Any further information you can find on our website. Consumers can actually go onto our website at any time and request a call back, so indicating which service that they're looking to hear more about or just know more about us. And our reception at either centre will give them a buzz back in the next day or so to give them that information and hopefully link them up with us. So far, so we've been open since 2021. We have completed over 20,000 individual sessions of care. You can see some feedback up there. I know we're conscious of time, so I won't bore you by reading it all out, but on the whole, it's good, which is lovely. Thank you. Here we have Julie's contact details and my contact details. Any questions, you can just reach out to us via email or call the centres for more information.
Thank you so much, Julie and Lisa. That's incredible. 20,000 in 5 years or 4 years. So that is about 4,000 or 5,000 a year. That's really a lot of work and a lot of help that you've provided. I was wondering, with some of your groups, do you have anything specialized in terms of grief counseling or chronic pain? Are there any psychoeducation groups that focus on those issues?
We don't yet have grief. However, we work in a partnership with This Way Up, which was developed by UNSW, which is they've developed some CBT modules that we often offer as a hybrid therapy with our student counsellors or student psychologists. And we actually developed our insomnia group from the This Way Up modules. There is a chronic pain module coming in the new year. And we're very excited, especially in Tuggeranong. We have a different cohort of consumers coming through. We're seeing a lot of chronic pain. So we're very excited for that module to be released early next year and to see if we can shape a group around it to deliver here in Tuggers.
That'd be good. Yep. Thank you.
Thanks.
Okay, so our 8th speaker tonight is Nova Marmion from Safe Haven. So Nova is a trained suicide prevention peer worker and soon will be a graduate social worker. Nova has worked at Safe Haven Belconnen since it first opened in 2021 and has been the service leader for the last 2 years. So thank you very much, Nova, and over to you.
Thank you, Leonie, and thank you everyone for joining me here today. So I'm from Stride Mental Health and I'm the service leader at Safe Haven Belconnen. So Safe Haven is located at 56 Lathlane Street, which, if you're familiar, is just at the Belconnen Health Centre. So we're just out the front of it. We're very close to the Belconnen interchange, so it makes us quite accessible. And our service hours are Tuesday to Saturday, 3 p.m. till 10 p.m. So we're a walk-in service, no referral is needed, no cost, no Medicare card. People can walk in, we are wheelchair accessible. People come at the time that they need to, and they can bring a support person if they would like. And as I said, we're very close to the bus station, so easily accessible for those who don't drive as well. So we are staffed exclusively by peer workers. We're all trained in mental health and especially suicide prevention. We use our lived experience of mental illness and of navigating the public health system to support people presenting in distress. So our experience enables us to provide real empathy and understand the experience of the people presenting to our service. So we're very experienced with complex presentations, highly distressed presentations, people who communicate and express their distress in atypical ways. We're very familiar with comorbid or co-occurring neurodivergence and mental illness as well. And we are designed to be an alternative to the emergency department for mental health. So instead of presenting to the emergency department when someone is feeling quite suicidal, having suicidal ideation, in severe distress, we encourage them to come to Safe Haven instead. So presenting to the emergency department, it can be quite a long wait. It can be many hours. It's a noisy environment, and often people are sitting alone for that time as well. Whereas if they come to Safe Haven, they're greeted by a peer worker. We can make them a cup of tea, get them a Tim Tam, and hear them out right away. We can hear about what they're distressed with, what's happening in their lives, and we can provide that support. So we support people aged 16 up. So there's no upper age limit. A lot of people think that we might be just a youth service, but we support people in their 80s. We support teenagers as well. We are aimed at suicide prevention specifically, so people who are distressed and suicidal. We provide crisis support. We can do safety planning. We connect people with other services and support them to do self-referrals or refer them directly. We help people learn and practice new coping skills for future distress as well. We are not a social space or community centre. Sometimes there's the misconception that people can show up and sit alone, read a book, do their uni work, but we are quite a small service and we do have to triage based on need. So we usually have 3 peer workers on at a time, which allows 3 people to be getting support. So sometimes people need to wait out the front. We do limit the length and frequency of visits. So we try to support people for roughly 2 hours, depending on their need. And we try to encourage people to come in a maximum of 3 times a week, but it is as needed. So we are a crisis service. We don't do therapy. We don't provide phone support. We do call people to follow up with them after they visit, but we don't provide phone support such as Lifeline would. We don't provide any medical treatment, but we do have the walk-in centre just about 100 metres away from our doors, so we can support people to access that as well if needed. For example, for self-harm that needs more than a bandage, we can walk them over there. And the walk-in centre is quite familiar with us, so people accessing them can actually wait in our service if they don't want to wait in the waiting room. If that's distressing to them, they can wait here and get a call from the walk-in centre when they're ready. We also cannot provide food or vouchers or any material support in that way, unfortunately. So those are our contact details there. Again, we are an after-hours service, so we're from 3 p.m. to 10 p.m. Tuesdays to Saturdays to fill in those gaps out of business hours when most other services would be closed. Please save our contact details and get in contact if you'd like to. Thank you.
Thank you, Nova. That's really interesting. And not advocating this because no one wants to do more paperwork, but if a person has come in distress, do you encourage them to let their GP know, or do you write to the GP or any kind of communication, or is that more up to the patient?
It's really up to the participant. So we try to be very person-centered and we are quite external from the rest of the public health system. So we kind of operate as people trust us to maintain their confidentiality. If there's reason for their GP to be aware of something, we do strongly encourage them to be in contact. But when we breach confidentiality, it would only be in the case of immediate risk to their well-being. So if we had to call emergency services, which does happen pretty frequently, but that is usually the only time where we would do something that the participant wouldn't want us to do in terms of contacting someone.
Right. Yeah. Thank you. Okay. So our last speaker for tonight is Peter Henry from Marymead. So Peter Henry is a registered psychologist and manager of the Marymead CatholicCare's Allied Health Services and located in Braddon. So thank you very much for being so patient, Peter, and over to you.
All right. Hopefully I'm sharing my screen.
You are.
Okay, good. All right, thank you, Dr. Horkhart, for the intro. So I'm from Marymead CatholicCare, governing Canberra. So I'll just keep it to MCCG for short because it is a mouthful. So our Allied Health Hub is located on Kooyong Street, 51 Kooyong Street, right across from the Canberra Centre. And we offer free parking for our clients that come in. So even though I'm going to speak on two or three programs in general, in our Health Hub, we have about 7 programs, which includes cognitive assessments. And our cognitive assessments we have a wide range of cognitive assessments to include autism and ADHD assessments. We have positive behavior support, NDIS counseling, and we're going to have 2 emerging programs in 2026, which will be DBT programs and a functional assessment, occupational therapy functional assessment. So those are 2 programs to look out for 2026 from us. So the several programs that I really wanted to focus on is our Next Step program. And what is our Next Step program about? It's a psychology service that offers intensive CBT treatment to clients with anxiety and depression. And so far, we have about 53% of clients that clinically recover at the completion of treatment. We offer up to 18 sessions depending on the client need. It's a no-cost service, and 79% of our clients experience reliable improvement at the end of treatment. It's a multidisciplinary team, so skilled clinicians trained to treat in OCD, PTSD, social anxiety, generalized anxiety, and depression. When I say multidisciplinary team, we have psychologists, mental health nurses, mental health counselors, and social workers. So we have that broad range. Within our Next Step program, we offer Cool Kids and Cool Little Kids. We offer that now over on the South Side as well as here at the Braddon office, and that's run from 3:30 to 5 in the afternoon on Tuesday and Wednesdays. Sometimes that changes depending on clinician availability, but we try and offer that at least twice per term. Programs designed to give parents and children the skills to reduce child anxiety and stress. 80% of our children who complete the program experience a reduction in anxious symptoms. I also wanted to touch on our Better Access program because that's a very popular program that GPs in particular will send us referrals through. In our Better Access program, we have 2 clinicians working that with a wait time that's amazingly quite low. It's about 2 months, actually. And we do offer that in person and telehealth. And that's where they come in with, well, actually, for the Next Step program, Better Access, we do require a mental health treatment plan and a referral for those programs. The last one I'll touch on, cognizant of time, is our early intervention eating disorder program. This is a program that's actually been up and running for about 3 years now. It's just taking traction like straight away. And we do need a mental health treatment plan and a referral for that because it's important to have that medical input and collaboration with that. We offer within our eating disorder clinic, we offer CBT-E, which is the individual therapy, and we also offer FBT, where the parents are involved with our teenage cohort. In our eating disorder clinic, again, the treatment sessions we find that for family treatment goes up to about 30 sessions, and our CBTE somewhere between 18 and 20 sessions. And again, a lot of traction on that with especially with high school students. Amazingly, a lot of adults who have come through as well. So if you want to learn about the array of our programs, you can go on our website, and that will explain all of our programs from our Braddon office as well as our Narrabundah office that offers more clinical or more counseling services. But I think one thing that we're proud of is we offer completely free services. So thank you very much.
Thank you very much, Peter. And sorry, did I mishear you at the beginning? You said you do autism and ADHD assessments.
Yes, we
Yeah.
do.
And
Yeah.
so is that needs a GP referral?
No, no, those can be self-referrals. And the thing with our COG assessments and even our positive behavioral support, there is a fee for service, so there is a fee for that. And if you go on our website, it has the breakdown of the fees
Right.
for
Yep.
those
Yeah.
services.
That's
Yeah, it's
incredible.
pretty nominal though.
Yeah. And is there a long waiting time for those services?
No, no, we have a consistent team and we're rolling through pretty quickly. So the wait time for cognitive assessments is about 4 months or
Hmm.
so. For our Next Step program, again, I do have that. Our Next Step program, we have low intensity and high intensity, sorry. And that's low intensity is our coaching service. They get 6 sessions. And if they require more service, then they get stepped up to our high intensity service. And that's between 6 to 8 weeks for that, 20 weeks for child.
Right. And sorry, one last question. For the cognitive assessments, do you assess kind of income to, do you preference low income people or?
We do, because we're a community based, but anyone that comes through that needs a cognitive assessment uh, can come in, can be referred in. We know that there's wait times across Canberra
Mm.
for COG assessments, so if we can help, we will.
Okay, right. Thanks. Very interesting. Sorry, there was one more question that I neglected to ask, and this one was for Medicare mental health centres. What is the wait time for DBT?
Well, we're
I
starting
was,
with that, so that's emerging.
yeah,
We put it together. We have the clinicians in place.
yeah.
Our aim is to do a teenage group first, a teenage and an adult group working with anxiety or depression, um, emotional regulation type of skills. Um, so hopefully, by the time we get back mid-Feb, we'll have that up and going, and that will be on our website.
Oh, that's amazing. Thank you.
And that'll
And
be a free service as well.
that'll be free as well. That's
Mhm.
great. Thank you. And also, Lisa, does your service also do the DBT, and what's the wait time for the DBT through your service?
Yes, so this might be a Julie question if Julie's around because she's in the city where we run it, but I did manage it until recently. So Julie would have more up to date. Are you there, Julie?
Yes, I am. Yes.
Oh, good. There you are.
Well, we actually don't have a huge wait time for our DBT program. So most people, it's usually about a term at the moment. Maximum would be 2 terms, but so, that might be 6 months maximum. But most people that are on our wait list would be starting in term 1 in February.
And we first do an eligibility assessment for it. So we identify in the initial assessment when people come to us that DBT might be a requirement or something they'd like to do. We then will do a DBT assessment specifically to confirm that it will be the right thing for the consumer. And once you are confirmed as DBT being the right fit for you and going onto our wait list, you can access the skills only group. So whilst you're waiting to get into the full comprehensive program and waiting for a clinician, you can actually get started in learning the DBT skills.
Yeah. And in saying that, some people actually just choose to do the skills only group as well. They don't necessarily have to go through the full comprehensive program. So you can do either or.
Correct.
And Lisa, you had a question, I think, for Peter. So did you want to ask that question?
I did. Peter, what's the name of the stream that does your cognitive assessments?
The name of the stream?
Yeah, of the program that does it. Is it a particular program? Or do we go through Next Step or?
No, it's just called the Cognitive Assessment Program.
Is it under mental? Because I was just looking at your website under services. Is it under?
It should be under counseling.
Counseling? That makes sense. I was looking at NDIS or mental health.
Yeah. I can get you.
Oh yeah, I see. It
That's
it
it.
is. You're right. It's under counselling. Thank
Okay.
you.
Okay. Perfect.
Okay, well, that's perfect timing to wrap it up. So thank you very much to all of our presenters. Really, really interesting. And it's good that there's a bit of cross-pollination between services as well. And I think it's good for primary care providers to know all the services that are available. And there are options for people struggling with mental health problems and with finance problems. So really good to see what you do and how hard you work. And that's it for tonight. Just to reiterate, 1.5 hours of CPD for any GPs that are attending tonight. And also that we'll be putting up the recording on our YouTube page shortly. So thank you very, very much, everyone, and good night.
Thank you.
Thank you.
Thanks.